Welcome to the Capacity Development with Sustainable Impact towards country-owned technical assistance. My name is Dmitri Davydov from Unicef. The global investments in technical assistance and capacity building represent some 10% of the total fund allocations by global multilateral and bilateral funders. And that is billions of dollars in funding. Yet, according to the funders themselves, the underlying strategies, policies, and governance structures are rendered only partially effective and sometimes in need of significant improvement. The COVID pandemic made this very clear that during the suspension of international travel, there is a need for innovation in TA delivery models and the shaping of effective local technical assistance networks. Today, we shall examine just what could such a significant improvement of the TA delivery architecture look like from three perspectives, presented by our three distinguished panelists. Our first panelist is Dr. Arletty Pinel, and she is a senior expert in global health and systems strengthening. She has a distinguished career of several decades as a medical doctor, as an advocate, and as an advisor to many governments and international organizations and civil societies. Dr. Pinel will be presenting a framework for a knowledge-based, localized TA system. In order to contextualize this framework in a country context, Dr. Pinel will moderate a dialogue with our second guest. And for many of you, she needs no introduction. This is Dr. Graça Matsinha, and she's a director of EPI in Mozambique. She's a medical doctor with a master's degree in public health from the Institute of Tropical Medicine in Antwerp. Our third guest today is Mr. Moussa Yazi, the head of business development at CESAG, one of the most celebrated and versatile authorities in business education and research in Africa. So based in Senegal, CESAG serves member states and the private sector of the West African Economic and Monetary Union and beyond. So Mr. Yazi will provide an overview of some of the many models used by CESAG to advance its vision to groom leaders who make Africa claim the place it deserves globally. After this three presentation, there will be a time for a engagement with you through a live question and answer. So I encourage you, as you are listening to the presenters, to type your questions and comments in the presentation as the presentations progress. So with that, I hand it over to Dr. Pinel.
Thank you, Dmitri. It's a pleasure to be with you and with our distinguished panelists. So we're going to talk a little bit about capacity development and how we can address the issue of country-owned sustainable technical assistance. We did a vast consultation and reviewed many reports and elements that are and interviewed many people in different types of programs. And there's a commonality here. One is that despite the costly supply, the TA demand from countries is not being met. There's a gap there. Also, a lot of the problems come at the subnational workforce level. So the programs have difficulty in reaching them and be able to provide consistency and the scale that is needed to achieve capacity development results in the long run. And the third thing is that there was a lot of dependency and the programs were heavily reliant on international TA. And that's the problem. And I think with COVID, it's more than obvious that with all the travel restrictions and everything that has happened in this COVID world, there is a need to depend more on national capacity. So today, I want to present this. We have two areas. We have one area that is focused on learning, and which is the technical component, the content component, the one that deals with the competencies that need to be developed. And then you have another line that is about the delivery of technical assistance, which is the operational component. What is the practice? And this is what we're going to be dealing with today. It's about the TA, or the technical assistance delivery. A couple of things when it comes to supply chain, for instance, is that capacity development is broad and it's escalonated. You have different levels depending on different approaches, depending on what you want to achieve. You start with targeted TA, and that targeted TA is very much around the issue of gap filling. But as you create a continuous improvement environment, you need more complexity in the competencies and more complexity of the TA provision. And that's when you start going into management and other elements that form that mid-complexity level. And at the top is because there are different skills that are very, with issues like technology management. How do you select the types of technology that you need? How do you ensure that they are appropriate in the programming? Those are more sophisticated, if you will, skills, but you still need them for very strong management. And this is important because as you go up and you have beside the pyramid, the different levels of the supply chain maturity. And as supply chains strengthen and become more mature, the more complex and the more integrated those technical assistance and capacity development efforts need to be. Just as an example of part of the issue of developing capacity is to actually start with what you have and be able to bring in tools that you have within the system. And this is sometimes difficult because sometimes we focus on our little silos. I would like to put the potential of the EVM 2.0 and during the TechNet Conference, you'll have a lot of possibilities of being able to discuss that in detail. But there's one particular element of the EVM 2.0, which is the element of continuous improvement and the issue that it's in the hand of the workforce. There's an app, every person in the workforce and the supply chain, immunization supply chain can assess their system. And that opportunity, instead of depending on international assessors, external assessors that come in once every 4 years to evaluate something, the fact that you have something that continuously monitors or has the potential to continuously monitor the system is an excellent opportunity for learning because you incorporate that in the training and you can measure the impact that the training may have over system performance. And that's where the accountability element comes in. And it is very important because very seldom we measure the impact of training or developing capacity with system performance. We talk about the number of people that we train, the number of workshops that we do, but not how it really impacts the system. And we need different tools to be able to measure that. Just quickly, there's a difference between support and strengthening. And there's a difference between health system support and health system strengthening. And Unicef has been working a lot in this differentiation. And you can see on the slide some elements that are different between providing input level interventions and more something that drives to the performance level. When we think about the supply chain, you also have that thinking. The health system support will be, quite limited, and basically, you procure the cold chain equipment. If you apply to Gavi for the CCEOP, there's an equipment, the development of distribution plans. These are tasks. But if you look about, and the technical assistant here is pretty much gap filling to be able to perform those tasks. Now, when health system strengthening comes, you're talking about a system, and you need a capacity development system to accompany that. That is not so. So when we think really about this is that if we go back to the original slide of the difference between health system support and health system strengthening, if you just want support, you'll continue to do gap filling. You'll continue to do workshops. You'll continue to do fly in a consultant for a specific task. But if you really want health system strengthening, you really have to go beyond and think about supply chain performance and maturity. And in this case, when we think about a network TA system, one that builds a network of national institutions, each one with different competencies, we have to organize that capacity development strategy and plan that even if the entry point is the immunization supply chain, you want to build towards health system, and this is the contribution of immunization into broader health system strengthening. So how do you build a model for a knowledge-based TA system that is not business as usual, but that takes in consideration everything that we have in order, and I love this quote about the competencies that you actually need. We need to learn and relearn. So this is the basic ecosystem that is being proposed. On one hand, we have capacity development and technical assistance and the content and the delivery, because you need both. You need the competencies, but you also need timely and relevant TA. But you also need knowledge management and continuous improvement. You need to be able to, there's a lot of information that is constantly being produced. We need to make sense of that and transform that into capacity development. And that's where the knowledge management and continuous improvement come together. But we also know that human resources are the best advocates. So we need to bring together everything that comes in within human resources in terms of acknowledging the difficulties that there are, being able to do the assessments and being able where the gaps are to be able to be filled, but also career ladders, or also the issue of qualification. And I mean, you don't want people to stay in the same place doing the same thing for 20 years. We wouldn't do that. Why would we expect that the workforce, the immunization and supply chain workforce will continue to do that? So that's why we bring together human resources planning and the capacity for advocacy. So we have some key components to be able to implement some of that. One of them is, of course, you need the government buy-in and leadership. You also need to co-create with national institutions and partners. And national institutions, it's not just universities. It can be vocational training schools. It can be local NGOs, and also the international partners that exist in there to support the system of how do you create a nationally owned national network of a network of national institutions to be able to plan together and deliver together. So the implementation, the key element here in this model is that the implementation is not fragmented and task-oriented. It is implemented consistently and continuously by a network of institutions, national institutions that work together, deliver together, and that cover a vast array of competencies, not only when it comes to supply chain specifics, but also management, also the issues of technology, gender, community mobilization, all the elements that you need to be able to have a comprehensive plan. And then whatever you involve, you need to replicate, scale it up, and sustain. We came up with 4 options, but I'm going to focus one that is to start at the subnational level, the other one of sub-regional multi-country network, another one that has the country twinning and something that is more of the future in terms of the future-ready hub. But I'm going to focus more in the subnational element. It's starting at the subnational level. Some of the problems that we have is that when we try the technical assistance or capacity development, so it starts here at the top and then trickles down. And when we see and we map where are the problems in terms of supply chain and program performance, they're at the subnational level. And many times that subnational level will be the poor performance of the system will match inequitable availability of training and capacity development for the people that work there. So the idea here is, how do you establish, even though you maintain the national government, because it's a national supply chain, national public supply chain, but how you start involving local governments and that consortium, if you will, that network of universities, training institutions, NGOs, private sector, and local governments to start putting together something that's very specific that can really address the needs at that subnational level, with the languages, with the cultures, with the learning patterns, with all those things that really are very specific at the local level. But it grows from there, and then it grows, it scales up, and then it becomes a national system to be able to address the needs that are some that are very locally specific, but some that are national, that are coming to at the national level to every program. So the important thing is that regardless of the option, those 4 options I presented at the top, regardless of which way a country decides to go or a region decides to go, we need to build upon what already exists, and we need to build collaboratively, because not one single institution and not one single program has the answers. We need a mix of institutions that are not really the centers of excellence. We need institutions that over time can become a network of excellence. So it's not starting with the top. It's starting with a mixture, because you want to build national capacity over time, national institutional capacity over time. And that's a goal in itself. You need to introduce people-centered social and technological innovation from the start. You need to plan for sustainability in many aspects: as political sustainability, managerial, technical, financial. Those parameters of sustainability need to be embedded in the design from the offset. And you need to establish a nimble architecture that's able to rapidly learn from mistakes, improve collectively, and respond to the needs the country may have in different times. And this is important because I think we all know how frustrating it can be when a country says, we need this TA, and then it takes 6 months for something to happen. So the idea is you need it, you plan for it, you deliver it as quickly as possible. So now, that's sort of like the theoretic framework. And that we're trying now to see how it could roll out and consult with countries of how a model like this could roll out. So now I have the pleasure of really interviewing Dr. Graça Matsinha, who's the director of EPI, and get some taste of this at the national level. So thank you, Dr. Matsinha. And I have a couple of questions for you. And the first one is, I know that the PAV, or the EPI program, has made has had major achievements in the last few years. And part of that is really in the investment of building the capacity of the immunization workforce. What are some of those gains?
Hi, Arletty. Thank you for such comprehensive presentation. Well, it's such a pleasure being here and sharing Mozambique experience on capacity building over the years. And well, as you all know, capacity building is one of our top priorities as a program. And we do acknowledge that there are limitations and gaps in the training processes, especially when we're talking about the initial training, when the prospective health workers are still at the schools. And based on that, and given we've been having the HSS on major investments during these years, it was specifically on the capacity building at all levels of the system. And that has enabled the program to grow in quality of service providing, but also it allowed the program to scalonate the intervention to more peripheral areas and to especially the hard to reach areas. However, ensuring good capacity to the health workers is a continuous process, which means that there's still a long way to go in terms of making sure that all the elements needed in order to ensure good and robust immunization program are there and available for the health workers. So in general, over the years, I think the major gain is the improvement of service delivery, but also making sure that immunization it's kept at the top of the political agenda. So I think those are the main gains that we have over the years. Over to you.
Yes, thank you. You mentioned the gains, and you mentioned some of the challenges. Are there any key challenges with, especially when we think about the immunization workforce and the immunization supply chain workforce? Are there any major challenges right now to bring the two together and within this health system perspective and the consolidation of the supply chain in Mozambique?
Yes, well, there are several challenges. I think what I can point as the first challenge is that we know that we have gaps, but identifying those gaps and the needs sometimes is not a very structured process. And if you don't have a very structured process to identify the gaps and the needs, it's very difficult to address those gaps and needs. So that's the first challenge. And the second challenge, it has to do with the dynamic of the EPI. The program is very challenging, and most of the times you have very competing priorities at the program. And when you have competing priorities at the program, it's really difficult to ensure continuity of the trainings, especially the trainings on supply chain. It's very difficult to ensure continuity. And in such situations, we will have a very fragmented system of capacity building. And if we have a very fragmented system of capacity building, we cannot ensure good quality capacity at the service provision level. And we're talking here about supply chain, but I think this can be translated in every other area of the program. The other challenge that I can point here, it has to do with human resources. We have, I can say we have a relatively high turnover of health workers. And as much as you invest in capacity building, if you provide capacity to a group of people and then 6 months later they're not there, you cannot ensure that the system will function well. So those are the major challenges that I can point. One additional challenge, I would say it has to do with translating all the information that we're getting in the trainings, in the processes of capacity building, all the data that we have and we are producing daily, translating all this to action sometimes is really challenging. So there's not a clear link of what we're doing daily and the capacity that is required for a very well functioning system. So I would resume the challenges in this four.
Yes, and in a sense, you're bringing some of the issues that have to do with the delivery of technical assistance and also the information management, the knowledge management, and have this as a rapid, apply those lessons learned in a way that is functional, and also the human resources and the relationships with the national human resources plans. when we think about a network of institutions, of local institutions, in this case, a network of Mozambican institutions, do you think that Mozambique has that those institutional capacities to be able to, with time, develop that network of national institutions to continually support and provide the technical assistance to API and supply chain management?
Well, that's for sure. I would say that we're very lucky that we do have a very good and very well consolidated structure of training institutions. And one thing that's very particular, which is good, is that the training institutions are not only limited to the big cities. We have training institutions throughout the country, and some of them are even in the districts. So clearly there is a good platform to create this network of institutions and create programs that will allow those institutions to provide technical assistance to EPI, and not only EPI, other health areas also might benefit from this experience. So I see there a very good opportunity. And besides the fact that we do have this structure, I feel that there is a very strong political will in country to reframe the capacity building process. So those are very good opportunities, and I think it's time to move to a new paradigm in terms of capacity building.
Yes, but it's when we talk to Gavi and we talk to other donors, and everybody acknowledges how Mozambique has really gone a long way in terms of institutional strengthening and very, very good quality professionals, even at the subnational levels. So something at this moment that is quite interesting is how do you bring all this together into a system that can better assist. Just to finalize this moment, and then we can open for questions. What would be your recommendations to the donors, to the international world, to the international NGOs, to the UN, in terms of supporting technical assistance and capacity development of national institutions? What would you like to see? What would you like the international world to actually support in order to be able to strengthen this network?
Mm-hmm. Well, I think we are in a very critical phase in Mozambique because we now finishing the first HSS, and we will soon move to the next HSS. So this per se, it's a good opportunity to bring this need of reframing the capacity building and the technical assistance in country. So it's a very good opportunity, and we should hold this opportunity. What I would like to see, well, we know that we live in an environment where we have a multiplicity of partners, and they're all keen to provide technical assistance to the countries. But this will only be possible if we have a very clear strategy of capacity building and technical assistance. And if we have a very good and clear strategy, it's very easy to get a buy-in from everyone, and they do have to abide to this strategy. So I think that's very important, and that's what I would like to see, a very clear and comprehensive strategy so that everyone who wishes to give technical assistance abides to that strategy. But more than that, I want to see the technical assistance processes more country-owned, because I do believe that we do have capacity in country. It's a process, I know. We do have institutions, we do have individuals that are capable of providing this technical assistance. And in this way, we can ensure a more sustainability in the capacity building processes. And it's much easier along the time to make sure that with this country ownership, the translation of the trainings and all the capacity building process, it's owned by the country, and we can ensure, improvements in the immunization service delivery in general. So that's what I want to see: a good strategy, good clear strategy, partners abiding to this strategy, and also creating capacity in the national institutions so that they can deliver this text that will ensure a better service provision.
Fantastic, Dr. Matsinia. So thank you very much. And over to you, Dmitri.
Thank you very much, Dr. Pinel and Dr. Matsinia, for providing both the global perspective and a country perspective of the country needs. And the message is loud and clear. We need more localized, more customized technical assistance delivery. And with that, I will be switching gears, and we'll be moving to Monsieur Moussa Yazi. We're very fortunate to have him today with us. Representing CESAG, who knows a thing or two on how to go in a structured, at-scale way, working with partners across the region, within countries, both public and private sector partners and development assistance, delivering targeted, customized, relevant, and timely technical support in all things education and training. So over to you, Monsieur Yazi.
Merci, Monsieur Davydov. Bonjour, mesdames, bonjour, messieurs. Mon nom, c'est Moussa Yazi. Je suis le coordonnateur-chef de la Business Development Unit du Centre africain d'études supérieures en gestion. Le Centre africain d'études supérieures en gestion, c'est une institution de l'UEMOA c'est une institution de l'Union économique et monétaire ouest-africaine qui comprend 8 pays. C'est une institution trentenaire donc, qui est placée sous la tutelle de la Banque centrale des États de l'Afrique de l'Ouest. Donc, c'est vraiment l'institution communautaire chargée du renforcement des capacités, notamment dans le domaine du management. Donc, depuis sa création, le CESAG a formé plus de 15 000 diplômés et nous recevons actuellement des étudiants et des professionnels de plus de 25 pays. Donc, c'est pour dire que le CESAG va au-delà de l'UEMOA et couvre l'Afrique centrale, l'Afrique de l'Est jusqu'à Madagascar, Djibouti et les Comores. Nous avons 14 enseignants permanents, mais nous travaillons avec plus de 200 enseignants associés. À l'origine, le CESAG est un centre dédié exclusivement à la formation diplômante. Nous avons des programmes de DSS à l'époque, mais depuis 2006, donc nous sommes entrés dans la réforme LMD avec les 3 niveaux de formation, licence, master, doctorat, avec notamment des programmes de master dans le domaine de la santé. Nous avons un programme de gestion des services de santé. Et depuis quelques années, nous nous sommes ouverts à la formation qualifiante qui est en train de devenir un pôle métier à part entière. Donc, nous délivrons aussi des séminaires, mais aussi des certificats et nous accompagnons des organisations publiques et privées dans l'appui conseil, notamment en études et diagnostics, en conception d'outils de gestion et en accompagnement. Nous avons mis en place aussi des unités qui sont chargées de valoriser tous nos travaux de recherche. Nous avons un incubateur d'entreprise et également une centrale d'études de cas qui est à l'étude. Donc, comme on le voit, le portefeuille d'activité du CESAG est très diversifié aujourd'hui. C'est la formation, l'appui conseil et la recherche. Alors, depuis quelques années, nous avons amorcé donc, une réorientation stratégique et pédagogique. Nous avons mis en place d'ailleurs un diplôme en ingénierie et gestion de la formation, donc qui fait que le CESAG est aujourd'hui reconnu pour la qualité de son ingénierie pédagogique, non seulement par les partenaires académiques, techniques, mais aussi techniques et financiers. Nous avons développé des séminaires, des certificats, mais aussi des activités d'appui conseil pour en faire un véritable pôle métier, donc au-delà de la formation diplômante. En termes pédagogiques aussi, nous avons innové parce que nous partons d'abord des besoins de nos clients que nous identifions au préalable et nous mettons en marche notre ingénierie pédagogique pour concevoir de nouveaux programmes de renforcement de capacités que nous mettons en œuvre et que nous évaluons avec des partenaires. Donc, nous sommes plus dans une démarche de co-construction avec nos partenaires, notamment pour relever les défis de développement. Et ces formations-là sont accréditées par des organisations spécialisées. Et c'est dans ce cadre que, depuis quelques années, nous avons des projets novateurs, donc qui donnent une idée du degré de confiance que nous accordent nos différents partenaires et je vais les présenter tout à l'heure. Alors, avec ces partenaires, nous avons identifié de nouvelles cibles. Donc, au départ, c'était des diplômés qui étaient visés, notamment du secteur public, du secteur privé. Et donc, les nouveaux axes de formation que nous avons identifiés avec certains partenaires nous amènent à cibler d'autres publics, notamment des non-diplômés, des décideurs politiques comme les parlementaires, par exemple. Et c'est pour cette raison-là que nous avons mis en place de nouveaux modèles pédagogiques, puisqu'avant, la formation au CESAG était présentielle. Nous avons mis en place des plateformes d'enseignement en ligne, donc qui nous permettent d'offrir des formations entièrement en ligne ou alors des formations hybrides. Okay. Alors, quelques exemples de programmes que nous avons co-construits avec nos partenaires. Le premier que je vais citer, c'est d'abord la licence professionnelle en gestion des petites et moyennes entreprises, petites et moyennes industries également, que nous avons développé avec le groupe Total et qui ciblait les gérants de stations-service, les pompistes et les gérants de boutiques, parce que la station-service de Total est devenue une PME avec la vente de carburant, la vente de gaz, mais aussi la boutique et puis les services d'entretien. Donc, c'était une formation en présentiel, mais au fur et à mesure qu'on épuisait le bassin de la région de Dakar, donc nous avons élargi cette formation-là aux autres régions du Sénégal et c'est ce qui nous a amené à offrir cette formation en ligne. Et aujourd'hui, nous allons au-delà du Sénégal pour proposer cette formation-là à d'autres pays de l'Afrique de l'Ouest et du Centre. Alors, un autre exemple de partenariat, c'est le Centre régional de leadership YALI, le Young African Leaders Initiative du président Obama, avec comme partenaire l'USAID, la Fondation Mastercard, la Fondation Citi, Microsoft et Adobe. Cette formation-là cible des jeunes de 18 à 35 ans de 25 pays. Donc, nous ciblons les jeunes de 18 à 35 ans de 25 pays africains, notamment francophones et lusophones, sans tenir compte du diplôme, parce que c'est une formation qualifiante, donc on n'a pas besoin d'avoir un diplôme universitaire pour entrer dans cette formation-là. Et aujourd'hui, donc, nous la déroulons aussi bien en présentiel qu'en ligne. L'une des particularités de cette formation, c'est tout le dispositif qui a été mis en place par rapport au coaching, notamment tout ce qui concerne le post-training, l'incubation et l'appui au financement. Nous avons aussi, nous hébergeons actuellement le centre Clear Afrique francophone, en partenariat avec la Banque mondiale. Donc, c'est une formation, bon, c'est un ensemble de formations qualifiante et dans le domaine du suivi et évaluation, de la gestion axée sur les résultats du développement et de la gestion de la performance. Donc, on cible en priorité les agents des administrations publiques, mais aussi ceux des programmes et des projets, des parlementaires, des responsables de suivi et évaluation, des consultants. Et je sais que des responsables de suivi et évaluation des projets de l'Unicef, des bureaux pays ont pu participer à une des activités de Clear Afrique francophone. Nous avons aussi développé avec la Fondation Mastercard un programme de renforcement des capacités dans le domaine de la finance inclusive en milieu rural. Donc, ces activités ont démarré en 2016 et la formation, c'était plus des séminaires et des certificats dans le domaine de la finance rurale et de la finance digitale en mode présentiel et hybride. Et tout récemment, en 2017, donc nous avons, avec le service allemand des échanges universitaires, et l'université de Kell et deux autres structures partenaires de l'Afrique de l'Ouest, notamment au Niger et au Mali. Donc, nous avons développé le Centre d'excellence de gouvernance locale en Afrique, donc qui vise à former des agents des collectivités territoriales dans les domaines de la décentralisation et de la gouvernance locale. Donc, la formation est de type diplômante, qualifiante, mais aussi certifiante. Nous avons aussi ciblé les acteurs des marchés financiers de la zone UEMOA, parce que comme je l'ai mentionné au début, nous sommes une institution communautaire, donc nous accompagnons les différents pays dans le développement des programmes de formation à vocation régionale. Donc, c'est à ce titre-là que le CESAG, en collaboration avec le Centre de formation de la Banque centrale, l'agence UMOA Titre et puis une structure britannique. Donc, nous avons mis en place un programme de certification des acteurs du marché financier. Nous avons signé tout récemment une convention avec Power Suisse pour offrir des certificats en ligne dans le domaine de la santé. Et le premier certificat que nous comptons délivrer en 2021, c'est celui portant sur les achats et la gestion de la chaîne d'approvisionnement en santé publique. Donc, toutes les formations avec Empower Suisse vont se faire en ligne grâce à une plateforme dédiée. Donc, nous avons développé d'autres partenariats parce que, comme je l'ai mentionné, notre stratégie, c'est de partir des besoins identifiés, soit à travers des tables rondes, soit à travers des analyses des besoins avec nos partenaires. Après, nous passons à l'ingénierie pédagogique. Et au niveau de l'ingénierie pédagogique, parfois, nous associons des partenaires. Nous avons dans ce cadre-là des partenaires comme l'ESMT, l'École supérieure multinationale des télécoms, avec laquelle nous avons une convention, mais aussi l'École inter-État des sciences et médecine vétérinaire de Dakar, qui sont toutes des écoles communautaires. Nous sommes en train de développer aussi avec l'École supérieure régionale de la magistrature, qui est basée au Bénin, la certification des magistrats en matière économique et financière, parce qu'on s'est rendu compte que les magistrats qui gèrent les affaires de délinquance économique et financière n'ont pas vraiment la formation nécessaire pour ce faire. Et toujours dans le cadre de l'identification des besoins, donc nous organisons des tables rondes. La plus récente que nous avons organisée, c'était il y a 2 semaines à peu près au Burkina Faso, avec les acteurs de la commande publique, donc tous ceux qui sont chargés de la passation des marchés, de leur exécution, de leur contrôle, de leur régulation. Donc, nous les avons réunis pour identifier les besoins dans ce domaine-là en vue de développer des programmes diplômants, des séminaires et des certificats dans le domaine des achats publics. Donc, voilà en gros ce qu'est le CESAG avec tout son portefeuille de partenaires bilatéraux, multilatéraux, nationaux et sous-régionaux, etc. Merci beaucoup.
Thank you so much, Monsieur Yazi, for this very inspiring presentation and the overview, sharing these examples that I'm sure will inspire the immunization supply chain global collaborative to improve our capabilities to and learn with you and through you on how to support countries. And so with that, we conclude our presentations and we will be able to take questions, some of them already coming through after a quick poll. Okay, thank you very much. We are almost at the end of the hour and we have just a few minutes to take some questions, and I'm very grateful to Shem for kickstarting it, and I'm wondering if Arletty, you are able to respond. The question is about the second important pillar of capacity development in countries beyond institutions, which is that pillar is the supervisors themselves. Arletty?
Yes, hi, and thank you, Kishan, for the question. And yes, supervision is extremely important. Let's remember that the word supervision is made of two words: super, which means extra, or superior, and vision, which is a sight and perspective. But there are a few problems. First of all, not always supervision is seen as a process of learning, of guiding, but a moment of inspection, of control that can lead to punishment. Also, the way that supervision is structured, many times it's structured top down. The boss supervises, the superior supervises, and not a system that actually starts with the first line of supervisors, and it's a bottom-up process. How to assess the quality of supervision? I mean, we talk a lot about training of trainers, but about supervision of supervisors. It is something that we don't touch. How do you maintain and develop the quality of supervisor? How do you update them? How do you go beyond the technical contents to address some other things, some other skills that you need, like human relations, management, human resources? In a nutshell, yes, it's important, but it's important the how and how it's embedded. Supervision is a skill. The quality of supervision is a continuous improvement process. And for that to be continuous, you really need institutionalization of the learning for continuous improvement. Otherwise, you're only going to have snapshots of supervision that really don't amount for much.
Thank you, Arletty. We have one question from Ernest Sommer to Grasa, but I realize I think we lost Grasa. I no longer see her as part of the the live participants. And the question is about the mitigation measures in Mozambique for the turnover. We can maybe park that and be able to respond that later on with Grasa on the TechNet website later on. And there is also another question from Ibrahim from Indonesia. He feels very excited to participate in this educational career development. Thank you very much, Ibrahim. So we would want to end the session on time, and we have just perhaps to conclude this, unless there are any other questions, with one question that I'll pose to Arletty with the current new TA, new technical assistance is being planned all the time. And now there is obviously COVID implementation of new vaccines, and also the restarting of immunization services, which is a very complex task. What advice would you give to countries and partners to make sure that they can build back better in terms of bridging that divide that Grasa Mazzini outlined, which is I quote her, that what we do in countries very often has no bearing on the capacity development. What can be done differently?
Well, the first thing is build with what exists. Nobody has a perfect solution all the time. And I think there has been major efforts throughout decades in building the capacity of countries and of programs. We have big challenges right now, not only because of COVID, but also challenges related to funding, related to sustainability, to political sustainability, to the rapid evolution of knowledge. So I would say that the best thing to address is to think of it as a system, not a snapshot. Capacity development and the TA that accompanies capacity development is a system. A system is complex. It's made of little pieces. Look at as much pieces as you can and then develop the system and accompany that with a with a monitoring and evaluation system that can actually be able to validate the decisions that you make. When one teaches, one wants a result. When you develop the capacity, you want to see a result. And that result is not how many people are trained, how many manuals you develop, but how strong the supply chain becomes because of the technical support and the capacity development that you have developed.
Thank you, Arletty. And to conclude, there's one last question from James about the strategies to reduce staff turnover and maintain the retention strategy. And I guess we can complete with your words on how that system is actually ultimately serving not just the purpose of making sure that the vaccines are being delivered, but also it's done with people and not bypassing people. Right, Arletty?
That's correct.
Right. And with that, so very much, thank you very much all, the panelists and the guests. We had quite a few participants. Very grateful, and we will look forward to sharing some further discussion points on the TechNet website. Thank you very much. And with that, enjoy the rest of the TechNet today and tomorrow. Thank you.